Hey everybody, this is Dan. Just wanted to bring you part two of our Fundamentals of Self-Treatment series. So today we're going to be talking about trigger point therapy. Trigger point therapy is a very simple, very effective technique that you can very easily learn to perform on yourself. I use it all the time in my practice. Very, very powerful technique and very easy to learn. So a trigger point, this is something that we hear about a lot. But essentially, what it is, it's a tiny little band of contracted muscle tissue that forms when a muscle is overworked. So certain fibers in that muscle become overworked. They become ischemic, meaning they're not getting proper blood flow. And when those fibers aren't getting proper blood flow, those tissues aren't getting the nutrition that they need. They'll tend to just lock up and they won't be able to release the contraction until they're able to get that nutrition again. And so what we're doing with trigger point therapy is we're going in there, we're applying pressure and releasing it, and that kind of flushes the area with a new blood supply. It brings nutrients to the area, it flushes out metabolic waste products, and then it allows the body to release that contraction so that the muscle can work properly and that pain can subside. So secondarily, what you're doing is you're also kind of tricking the nervous system in a way. So when you're applying pressure, you're activating something called the Golgi tendon organ. This is a nerve fiber that is really crucial in protecting the muscle from tearing. So a lot of times with really heavy lifters who are lifting tons and tons of weight, you'll see that when they're straining to do a lift, sometimes their muscles will just give out and they'll just drop it. That's the Golgi tendon organ acting to protect that muscle from tearing, and it senses tension on the muscle, and what it does is when it senses what it thinks is too much tension, it will just send a signal to the muscle to just relax and let everything go so that it doesn't tear. So this is kind of what we're accessing here with this kind of therapy. So we're gonna test this out today on the upper trap muscle. Very common muscle to have trigger points in if you have a lot of headaches, headache patterns above the eyebrow here, into the back of the eye, along the temple here. These are all very common pain patterns that have to do with upper trapezius trigger points. So the upper trap runs from the back of the head, the occiput, all the way down the neck and the shoulder, into the back of the shoulder here. So all we're going to do is we're just going to take the pads of our fingers, place them on the back of the shoulder here, right near the base of the neck, and then you're going to take your thumb and you're going to find this little flip of muscle tissue. So you're kind of pushing up, you're pushing your thumb into that tissue, squeezing with your fingers as well, and you're just kind of pinching all that muscle between your fingers. And I want you to just run your thumb up and down. You should feel this little flip of muscle tissue here. You should feel it, especially when you flip up onto it. So we're going to fall down and off of that flip and underneath, and we're just going to kind of tuck the thumb under that muscle tissue and press it up against the pads of our fingers. So I don't know if you can see that better here. So we're pinching that muscle between the fingers here, and you're just going to keep applying pressure in little segments here until you feel a tender spot. And actually I feel one right here, and you may feel some radiating pain up into the back of the neck. You may feel those pain patterns up into the head, those headache pain patterns that I talked about. That is an excellent sign that you're on an upper trapezius trigger point. So once you find that, a tender spot or a spot that refers pain, you're just going to hold that pressure. As soon as you feel that pain or discomfort, you're going to stop applying pressure right there and hold that same pressure. And now what we're going to do is we're going to breathe in through the nose, out through the mouth, and really try to focus on the exhale. Really try to make the exhale twice as long as the inhale, and you're just going to hold that for about 8 to 12 seconds. So this is a really good gauge as to how well you're doing the technique. If that pain starts to subside before 8 seconds is up, then you're probably not using enough pressure. If that pain is still there after 12 seconds, then you're probably using too much pressure. You need to back off a little bit, try it again. So you want to really get in that sweet spot of 8 to 12 seconds where you want to feel that pain start to subside. Once you feel that, move on to a new area, try to find another one. If you feel like you've worked all the way up and down the muscle, and remember it goes all the way up to the back of the neck, you can go a little bit deeper and see if there's some deeper trigger points. But that's pretty much it. And this is a technique you can use all over the body for really any muscle in the body. So all you're doing is you're applying pressure. So you can do that either by pinching the muscle or just by pressing directly into it, either with your thumb, or if you're using a tool like a lacrosse ball, a tennis ball, a foam roller, something like that. Those are also great tools to use with these techniques. So that's it for today, guys. Hope you found that helpful. And thank you guys for watching. See you next time.